Good evening, I'm Benjamin Wea, and this is my introduction speech for COM 231. This is the speech outline that I will be using to aid in my extemporaneous delivery of the speech tonight. Thank you. If you looked at an orthopedic surgeon's toolkit, you might think that you were in a Home Depot and not the operating room. And that's because the tools that an orthopedic surgeon uses are a lot different than the microscopic, very specific tools used by neurosurgeons or vascular surgeons. An orthopedic surgeon needs to be able to break and remake bone. So they're using hammers, drills, hacksaws, and even bolt cutters. And when I first saw an orthopedic surgeon using these tools, that's what piqued my interest. An orthopedic surgeon provides some of the most definitive treatment to the most debilitating injuries, from sports injuries to the elderly breaking their hip. You need an orthopedic surgeon, and my dream is to become one. I was inspired when I was a combat medic on a forward surgical team with the U.S. Army deployed to Afghanistan in 2018. I worked alongside orthopedic surgeons and saw them using, again, all of these exciting, unique tools that I would never expect to see in an operating room. But the way that they used them dramatically improved the quality of life of the surgical trauma patients on our beds. I saw them work for hours so that they could save limbs, so that they wouldn't need to be amputated. And that's the work that I dream to do. But becoming an orthopedic surgeon requires a serious commitment of time and money. It's worth it though because of the earnings that you'll make and the life-changing impact that you can have on a patient's life. In this speech, I will discuss the education requirements, the duties, the earnings, as well as recent advancements in orthopedic surgery. So, let us begin by discussing the education of a fully certified orthopedic surgeon. The first step for a prospective orthopedic surgeon is to get a bachelor's degree in preferably a scientific field. Learn.org recommends either biology or organic chemistry. These are both good options that will help prepare you to take the MCAT. The MCAT is the Medical College Acceptance Test that is nationally recognized as a requirement to enter medical school. And the higher you score on the MCAT, the more competitive that you'll be for your choice of medical school. So then, after you finish your bachelor's degree, you go to medical school. Medical school is an additional 4 years of education, at the end of which you will be a medical doctor or a doctor of osteopathy, but you won't be certified to practice any specific kind of medicine. And that's why you need to go into a residency program. So you apply to a teaching hospital for an orthopedic residency, which is an additional 5 years of education while you are working. At the end of the 5-year residency, some surgeons choose to do a 1-year fellowship to specialize orthopedic surgery even further, such as trauma or spinal surgery. So that gives us between 13 and 14 years of education to be a fully certified orthopedic surgeon. Well, what will you be qualified to do afterwards? As an orthopedic surgeon, according to the American Association of Orthopedic Surgeons, you can provide care to a variety of musculoskeletal injuries and diseases, such as non-surgical interventions like monitoring a cast or applying casts and splints to broken extremities, to complex invasive spinal surgeries and fusions, and as well as finishing amputations. You can expect to work very long hours, especially during your residency. You should expect to work at least 80 hours a week. You're often in charge of many nurses, physician assistants, and other non-orthopedic doctors. Now let's see if dedicating a massive part of your youth to the education and hard work is worth the squeeze. Orthopedic surgery is one of the highest paying fields in medicine, according to Jacqueline Smith with Forbes.com. The nationwide median pay for an orthopedic surgeon in 2020 was $479,000 a year. Now, the North Carolina average is about $334,000 a year, according to ZipRecruiter.com. But this pay does vary drastically depending on your skill as well as your location. Anywhere as low as $250,000 a year to as high as $700,000 a year. Still ranking it as one of the top paying medical specialties, alongside neurosurgery and cardiothoracic surgery. Orthopedic surgeons with their long education are as much a scientists as anyone else in medicine. Ramey Miller with the Association of Perioperative Registered Nurses details some of the newest advancements in orthopedic surgery. These include the use of stem cells to reduce the reliance on the surgery, and 3D printing of implants using biological material to assist in recovery of damaged joints and limbs. Less invasive surgery techniques are also becoming more and more popular. Now, in conclusion, becoming an orthopedic surgeon requires a great investment of time, energy, and money, but the earnings and the impact that you can make on a patient's life make it worth it. If we are living longer than ever and outlasting our joints, so when you need your hip replaced, rest assured that you are in the hands of a highly trained and well-compensated orthopedic surgeon. Thank you.